And getting back to normal safely is going to take some time, but the big question, what will it look like?
From more widespread testing to securing personal protective equipment, the governor and other state officials today outlined some of the same standards shared by local leaders on how we all get there. Mary Jo Ola explains.
It's the question on so many people's minds. How do we get back to normal? Local leaders agree that we have to meet a few benchmarks first.
It's got to be done in an intelligent way so that we don't have a setback that's going to make it even worse than what we're facing right now.
From his home, Mayor Tom Barrett says he and his staff meet regularly on how to safely reopen Milwaukee as COVID-19 upends lives. The mayor lists 5 criteria for lifting restrictions: a sustained drop in cases for 14 days, more testing, hospitals treating patients without crisis standards, more personal protective equipment or PPE, and more tracing of COVID-19.
And I am convinced that if we can stem this at the community level, and so that means testing, followed by isolation, followed by community tracing, that's going to be the key.
I think those benchmarks really are sort of protective factors.
Kirsten Johnson is the director and health officer at Washington Ozaukee Public Health. She agreed with the standards laid out by Mayor Barrett for reopening.
We just want to be cautious and make sure that it's done gradually so that we don't have a huge spike that we're unable to handle.
But Director Johnson says when we are able to reopen and get back to some sense of normalcy, even that will be different.
I would imagine there's going to be some things in place for a while, like wearing masks in public, or when we go to a restaurant, there's going to have to be social distancing when your tables aren't going to be next to each other, or even gatherings at home may have to be less than 10 people for an extended number of time.
It's a shift that Governor Evers says won't happen now until May 26th at the earliest. Mary Jo Ola, TMJ4 News.